Friends, today we are talking about screening test. Screening test is such an important thing nowadays because of COVID-19. Everybody talks about whether you have done test or not. Almost it has become a day-to-day life. But do we know what is the screening test, when it should be used, which test should be used? There is lots of confusion among the people as well as also among the top leaders. So today we will simplify the topic, the screening test. Let's find out what is screening test. Just we are going to see some of the key parameters, that what is screening test, then when it should be used, then which kind of test when to be used, and based on that then we will come to decide what is the use of sensitivity, specificity, positive predictive value and negative predictive value. At the same time, we will also like to find out what do we mean by false negative, what do we mean by false positive. So this is the topic which we are going to cover today. Now first, what is the screening test? The moment people talk about screening test, it comes to the mind that some kind of laboratory is to be utilized. No. Screening test can be done just based on the history, it can be based on the physical examination, and it can also be done by the laboratory examination, or it could be a radiological examination. Basically what we are doing is screening test. We are approaching apparently normal population, and from that we are trying to find out whether there is a particular event or particular disease is there or not. For example, when people are employed, they undergo X-ray chest just to find out is there any probability of a disease of tuberculosis or pneumonia or something like that. But the WHO said that now it is no more required. Why so? Because by doing screening test of a chest in apparently normal person, you are not gaining much thing. Suppose if you are going for a diabetes test, screening test for the diabetes, probably in apparently healthy people you may be able to find out the diabetes positive. That means the person might be suffering from diabetes, but person is not aware of it. So here is the concept that you try to find out a disease in apparently normal people, that we simply call as a screening test. While the diagnostic test is usually done on a single person to find out a particular disease and maybe a multiple of disease, while usually screening tests we try to find out a particular disease in a population. Sometimes we combine 2-3 diseases also together. But in screening test it is very clear that as far as possible we try to go for non-invasive test as much as possible. So now once we know the screening test which is usually done in apparently healthy population, let's find out what kind of tests are there and why it should be used and when it should be used. So first let's say that when it is used, just like epidemic which we have COVID-19, masses are screened for the purpose of to find out whether the person is suffering from COVID-19 or not. If there is some epidemiological investigation which you want to carry out of a particular disease in a population, say for example you want to find out prevalence of some disease or incidence of some disease or maybe a point prevalence, for that kind of thing you need to find out epidemiologically, or you want to carry out some research that in a particular population how many diabetic people, other population how many diabetic people. So of hypertension between two population, that kind of research if you want to find out, then you can do the screening test. Then the social service, suppose early diagnosis of disability in case of the children, you can have a corrective measures. So as a part of social service you may be doing screening test. Other example, insurance. If you are having some disability, then insurance people will charge you more. That's why they want to go for the screening test or health checkup. The beautiful name of a screening test is sometimes used as a health checkup to find out if something abnormal is there or not. And there is if new employment is there in the industry, then also it is done. Then for prevention of infectious disease, suppose a particular population is not suffering from yellow fever, and then they would not allow a person coming from the zone where there is a yellow fever is epidemic or endemic. Then from that country, other country where there is no yellow fever, they will not allow. So, they would like to screen for a particular thing. And now, how many tests? Screening can be done with a single test, it can be done with a multiple test, or for the same disease multiple tests can also be utilized, or maybe 3 or 4 diseases you want to screen yourself. At that time also you can go for multiple tests. Then another important thing is multiphasic screening test. For example, in a population you want to find out the prevalence of the heart disease. Then at a stage you need not go for echocardiography of each and everything. But in that case, first you may go for a simple ECG test or simple history, etc. And then if required, in subsample those in which it is indicated, even though they are not having a clear-cut disease, but they are positive to some extent, that for further investigation you do a detailed investigation. That could be a multiphasic, phase-wise, that is also possible. Now, how to decide which test is to be utilized first or which test should not be used? For that we need to understand the sensitivity, specificity, false positive, false negative, etc. Now, screening test, understanding this is so simple that if you understand this, you will never forget in life, even if you want to forget. Let us go for that. What is sensitivity, what is specificity, etc. Now, here I have given 2 examples. In this test A, test B. For example, in case of tuberculosis, you have a gold standard, positive and negative. But you want to use a test A as a sputum for AFB and X-ray chest, that you want to compare. Then how to find out which test is to be used, which test is better? For that you need to compare sensitivity and specificity. Sometimes the combination of this test is much better than the individual test. But how to decide that? When to use, how to use, whether we should combine or not, whether we should not combine. Sometimes just by changing the cutoff line, you can increase the sensitivity, specificity, and that kind of features also we can understand. We will take few examples later on, but let us try to find out what is sensitivity, what is specificity. In example A, here the gold standard says that positive and negative. Total 2000 population were screened. In test B also 2000 population were screened. Now, if you look at both places, the gold standard is 1600 negative and here also 1600, because we use the same gold standard, and here 400 positive, 400 positive. Now, what is the commonality is this 400, 1600, 2000, because it is based on gold standard. I repeat, 2000 population were screened, all the population, all the 2000 people were screened with help of test A and test B. Now, in this let us compare the result. In this case, the gold standard could detect 300 out of 400. I repeat, the test A could detect 300 cases as a positive out of 1400. So, this 300 out of 400, that is maximum capability of a test to find out maximum positive out of total positive is a sensitivity. Even with a small the stimulus, person is irritated, is highly sensitive. That means even a small presence is there of a disease, this test will detect. That means is highly sensitive. Now, in this case test B, it could detect only 100 out of 400. That means sensitivity of this test is much less. Here if you want to find out in terms of percentage, for example, this is 300 out of 400. That means 300 out of 400. If you convert into a percentage, then it will be 75%. That means this test is capable of finding out 75% of total number of cases as per the gold standard. While if you see what is the sensitivity in test B, it is 100, this 100 out of 400. Because we want to convert into a percentage, we are going for multiply by 100. So, it is 25%. So, you can say that if in a population there are 400 cases, this test will be able to find out 75% of the cases, while this test B will be able to find out 25% of the cases. So, this is a sensitivity, ability of a test to find out total positive out of total positive. So, how much the power of detection is a sensitivity, 75%, 25. This is clear about sensitivity. Along with the sensitivity, we should look at false negative. In this case, you can see 700 are negative. In this case, 900 are negative. Here it is 100 negative. These three negative, negative. But in this case, what is labeled as false negative? Just remember, instead of using false negative, if you use a word falsely labeled as negative, I repeat, falsely labeled as negative even though they were positive. If you remember the word false negative forever in your life, read like this: falsely labeled as negative even though they were positive. Then you will get the word false negative. So, in this case, how many were labeled as negative even though they were positive? Look, there are 400 positive cases according to our gold standard. Clear? Out of that, 300 were labeled as positive, but this test A labeled negative 100 people. So, 100 out of 400 were labeled as negative by this test even though they were positive. That means, what is the percentage of false negative? 100 out of 400? %25. So, if you improve the sensitivity, right, then your false negative will reduce. Always this total sensitivity and false negative will be 100%. So, instead of using the word false negative, if you use the word falsely labeled as negative even though they were positive, you will ever remember that these two figures will make a 100%. So, higher the sensitivity, less the false negative. Higher the false negative, less the sensitivity. These two are complementary to each other. Let us see what happens in test B. In this case, out of 400, 100 cases were labeled as positive, true, but 300 were labeled negative even though they were positive, because 400 were positive, 100 were labeled as positive, this is okay, but 300 were labeled as negative. That means falsely labeled, 300 people were falsely labeled as negative even though they were positive. So, in this case, 300 upon 400 multiplied by 100 is equal to 75%. So, try to understand that these two total, sensitivity and falsely labeled as negative, are 100%. So, if you compare these two tests, here the sensitivity is much more and false negative is less. In test B, sensitivity was very less and false negative were very high. So, this is very clear about the sensitivity and falsely labeled as negative. At midnight also you try to remember that falsely labeled as negative. Now let us see for the next thing, specificity and false positive. This is also 100%. Let us see how. In this case, out of 600 negative cases, test A could detect 900 negative cases. That means if test is very choosy, you would like to have this but not this. Will say clearly, yes, it is this, I would like to have this, but not this, not this. So very choosy. If the test is capable of finding out maximum negative out of total negative, the specificity is very high. Specific, it will find only if it is there. That is high specificity. If a test is 100% specific, then it will always detect only if it is there. So the specificity, if you want to find out, this test was possible to find out 900 out of 1600. So 900 out of 1600 is ability of a test to find out negative out of total negative. So that means this would be a percentage, approximately you can go for that. Let me check something like around 58% or so approximately. And if you see the falsely labeled as positive, we want to talk about now falsely labeled as positive. So the word which you should use, that falsely labeled as positive, because you see this 700 figure are labeled as positive by this test A even though they were negative. Out of 1600, this 700 which were negative were labeled as positive by this test. So 700 people out of 1600 were labeled as positive even they were negative. So this is known as false positive. You should use the word falsely labeled as positive even though they were negative. So you can find out the percentage somewhere over here. Mm-hmm. 8, 350, 175, 4, 40 and something like something like 42 or something, some percentage like this. So the total of this two will be 100%. So if you remember that if specificity you are increasing, then false positive will reduce. If you reduce the specificity, false positive will increase, because total is 100%. Now see what happens in test B. Let us try to find out what is there in test B about specificity. I repeat, ability of a test to detect maximum negative out of total negative. That means 1200 out of 1600 are truly found out as negative. Also sometimes people use the word true negative, here the true positive. That some words are sometimes used. So 1200 out of 1600. So somewhere it would be around 608, 4 and 300, something like 75%. So specificity in this case is 75%. Now how many false positive? Out of 1600, 1200 were detected as true negative, but unnecessarily, falsely 400 people were labeled as positive even though they were negative. So 400 out of 1600, 400 out of 1600 multiplied by 100, that means 25%. So here in this case the rate of false positive. I repeat, falsely labeled as positive even though they were negative, that is 25%. That will specificity and false positive together will make 100%. If you increase the specificity, the false positive will decrease and vice versa. So, now if you are clear about these 4 things, sensitivity, false positive, false negative, everything, last 2 points which we want to cover in few minutes, that is a positive predictive value and negative predictive value. Now, suppose if a COVID-19 test is positive of a particular person, what is the likelihood that he is really positive? That means the prediction of the test, how far it is true. Negative predictive value means if some is going for, let us say, a COVID-19 test and he says negative, then patient can ask to the doctor, doctor, what is the probability that I am really negative? What is the probability? So, that probability of a yes you are really positive or yes you are really negative, that is known as positive predictive value and negative predictive value. Let us go for that. Both are very simple. Let us see how it can be calculated. In this test, total 1000 are positive, okay, very clear. Out of actually how many were positive? 300. That means when this test says that you are positive, probability that the person is having a real positive is 300 out of 1000. That means how far it is to positive predictive value? 300 divided by 1000 multiplied by 100 is equal to 30%. That when this test A says that you are having a positive, that means 3 out of 10 or 30%, 30 out of 100 are really positive. Otherwise, it is a bakwas. Rest of the time, it is not positive. So, positive predictive value of the test is total number of real positive out of total positive detected. So, that is a positive predictive value. When a test says that yes it is positive, what is the likelihood that the person is really having a positive? That is a positive predictive value. And if you look at the negative predictive value, in that case same thing, the 1000 people were saying yeah you are negative, but actually how many were negative? 900 were negative. That means 900 out of 1000 are really negative. So, the negative predictive value of a test is equal to 90%. Test is same, but when this test says you are negative, the probability is really negative is 90%, while this test if says you are positive, the likelihood that really positive is 30%. So, this is how we can calculate positive predictive value and negative predictive value. Let us do it again for test B. In this case, the positive predictive value 100 were positive out of 500, simple. Positive predictive value 100 were positive out of 500, that means 20% is a positive predictive value of this test. What about negative predictive value? Here total 1500 label as negative, out of that actually 1200 were negative. So, the test is correct 1200 times out of 1500 times. So, negative predictive value of a test is 1200 divided by 1500 multiplied by 100. So, it will be 15, 30 or 80%. 3, 20 and 20%, 80%. So, negative predictive value of this test is 80%. If you compare these two tests, this test is a negative predictive value is less compared to this, but Here also positive predictive is also less. So, if you look at this figure, this test is less compared to this. If you look at the sensitivity and specificity, also you need to compare. Now, which last but not the least, which test we should use when? So, first if you go for the community screening purpose, this is a very important topic which we end with the topics, is that first in the community you try to find out maximum number of tests, maximum number of cases you try to find out with a very high sensitivity. And before you start a treatment, you try to find out, you apply a highly specific test in this population, because you have maximum sensitivity and then highly specific. Rest of the population you can keep under observation. So, try to detect maximum number of positive cases from the community or from the population which we want to screen, and from that, once you have detected maximum number of positive cases, and from that, on that you apply highly specific test, so that you treat the only those who really require the treatment, and rest of the population can be kept under the observation. So, let us end with a very simple thing, that when you apply the screening test, it should not be with a motive that let me find out high number of hypertension, high number of thyroid and high number of the diabetic cases, etc., so that you have a patients for long time. Rather than you should try to find out the cases much earlier, yes, but try to treat them with the lifestyle change, or let us say a positive health or health promotion, etc., rather than starting the drugs. Because sometimes because of a lot of pressure of company for using more drugs or bringing more patients, etc., there is a competition of health checkup program is free. But then when you label a person as a diabetic, from that day diabetes starts because of a stress of diagnosing a disease. So, screening, when you are doing screening or health checkup, do not do something which harms the population. For example, in COVID-19, when a person was found out to be a positive, he started having a feeling a problem that I will now die, and the immunity will stand down, and then person, even if not having a disease, will start having lots of disease. So, when you do a screening, do in the right spirit, that is very important. Now, only one point, if you have only one test and the same test you want to use for highly sensitive, highly specific, I will give one example whereby you will understand. Let us say I have a anemia detection chart, and there is a mirror over here. By looking into the mirror, you can find out whether here is the photographs, where you can find out whether tongue, these are the photographs, right, and let us say we have such 8 photographs. 1, 2, 3, 4, 5, 6, 7, 8, and this is a dark, a little bit less dark, less than like this. 8 is most anemic, this is most red color, hemoglobin is more, here hemoglobin is less. Now, you go with this chart to the community and you want to use the same test for highly sensitive, highly specific, etc. What do? So, go to the community, tell the people, if you look into the mirror and if your tongue is 1 and 2, no problem, but 3 onwards you label yourself that you may require some kind of dietary change or maybe a drug. So, this, when you use this cutoff 1 and 2, the test becomes highly sensitive. Most of the population having anemia, this test will be able to detect. Highly sensitive test. Now, same test, same tool, if you want to use for highly specific, simply change your cutoff line. Tell that if you are having 7 or 8, you are having anemia. That means test becomes highly specific just by changing cutoff line. Now, how do you use in the society? say try to find out row 3 to 8, treat all as anemic, treat 7 and 8 with the treatment with the tablets, etc., and rest of the population keep under the observation, follow them up, and then over a period of time you will be able to find out who were really anemic or not. Or you can use hemoglobin also along with this, find out the concordance. This is how you can use sensitivity and specificity just by changing a cutoff line. I hope you have understood about the screening test, what it is, when it is used, when to use high sensitive, when to use high specific test, what do you mean by sensitivity and specificity, what do you mean by false positive and false negative, what do you mean by positive predictive value and negative predictive value. I think it's very clear. My name is Dr. Rajesh Mehta. I work as a professor head in Department of Community Medicine, GMES Medical College, Sola, Ahmedabad. Thank you.